the actual trend of doing more real-world evidence trial now, and also the trend of integrating clinical trial design with clinical practice. When we design clinical trial, take that into account, marrying a clinical practice with a clinical trial type of design to evaluate a certain hypothesis. That would definitely help and also reduce the manpower needed separately for a clinical trial as well as your clinical practice.
If the drug is approved in the US and now you have real-world data in Hong Kong collected in a very systematic and structured manner, this data will be extremely useful for direct registration or for facilitation of a sort of smaller scale phase 3 study. So I hope the Hong Kong government can try to work out a real-world data center or institute or whatever you call it, based in Hong Kong but cater for Greater Bay Area. Because if you are not doing that, other cities may want to do it.
I actually think Hong Kong has a major advantage globally on the ability to generate real-world evidence, because we're one of the few places, when you look at a population of, say, 7.6 million, where you've actually got connected patient records between hospitals and the private clinics. I think we could take first mover advantage in this space and actually be a global leader within the next 3 years, if we put in the right infrastructure to drive it. I think we are sitting on an infrastructure with a level of experts that are amazing, and we can absolutely be a global leader. I think we have everything in place. We just need to tweak those steps, and then I think we can fly.